Hi, I'm Megan, and welcome to Girl Talk. In this episode, we're continuing our journey through pregnancy as we explore the second trimester. Once again, we'll be joined by our expert Prof Manisha, who'll be guiding us through this process and telling us about what to expect during these pivotal weeks. We'll talk about some significant milestones, as well as some do's and don'ts, and perhaps maybe what normal things to expect during the second trimester. If you've missed our first episode on the first trimester, do be sure to check it out, as well as to like, subscribe, and share Girl Talk on all your social media platforms. We'd like to welcome our guest now, Prof Manisha, once again. So Prof, now moving into the second trimester, how do patients normally feel during this time?
Much happier, much better. So, usually their nausea, vomiting, their, fears, that are settled and it's true that the risk of miscarriage is much lower in the second trimester. So they generally physically as well as mentally start feeling better adapting to pregnancy, and, rid of their nausea, vomiting, tiredness, sleepiness, all that. So more energy.
Right. Okay.
So they are usually, they feel in a safe space and they're happier.
That's good to hear.
Yeah.
So with, feeling better, there's of course more things to do now in the second trimester. Do you mind bringing us through maybe the very significant milestones that women should expect during this time?
So as you know that they usually see the obstetrician once a month.
Yeah.
The main landmark, I would say, of the second trimester is the fetal anomaly screening scan.
Right.
This usually happens at around 20 weeks.
Okay.
Anytime between 19 and 21 weeks.
Okay.
So what we are trying to do in this stage is to actually screen the baby for any structural abnormalities.
Right.
So we have a checklist that is our sonographers who are specially trained in keeping with international standards. So they screen the baby from head to toe for any major structural abnormalities. We also look at the growth of the baby, where the placenta is situated, is the water level, normal or not, and usually if people are not aware of the sex of the baby, then that can be confirmed at this stage, or if they already have an IPT, we can double confirm it.
I see. So it's kind of like a midpoint check mark, a very detailed ultrasound scan, so similar to all the appointments, just maybe a bit longer with it.
Oh, definitely. So it can sometimes take longer. I usually tell my patients, don't worry if they ask you to go outside and walk. It's not because there's something wrong with the baby. It's just that position of the baby is such that it needs much longer. They need the baby to turn to see everything in its entirety. The only other thing we check for is, uterine artery Doppler test. That is the, blood flow to the uterus that is in both the uterine arteries. And that can predict the risk of preeclampsia and a small baby. So that is usually done at this stage as well.
I see.
By most centers.
All right. So then say if the patient clears that and, everything is normal, everything's good with the baby, what would the next thing that they would have to expect?
So the other thing that happens, and it's a very exciting thing, is baby's movements.
Right.
Yes. The first time mums will usually feel movements maybe around 20 or maybe around 22 weeks.
Right. Okay.
And they sometimes in the beginning, they actually don't even realize what they're feeling. So they may feel bubbles in their tummy. And then gradually, they will feel the movements perceive the movements and know what they're feeling. However, the second time mums or the third time mums are obviously aware, and they can feel the movements as early as maybe 18 weeks.
Wow.
Yeah.
So the veterans know better.
Yeah, definitely. Experience matters.
Yeah, it does.
The other landmark thing that happens in terms of, tests in pregnancy is the oral glucose tolerance test.
Right.
Or the OGTT or the sugar test that we call it. So that is usually carried out anytime between 24 to week 28.
I see.
So we used to offer selective screening in Singapore, but now we also offer universal screening, meaning everyone is recommended to go through the screening test.
Right.
The reason is that the incidence of gestational diabetes or temporary diabetes of pregnancy in Singapore, amongst the Singaporean pregnant women, is 1 in 5.
I see.
That means 20%, which is very, very high. So it means that it should be offered as a universal screening test rather than selective screening.
Okay.
Perhaps in Caucasian population, because the incidence of type 2 diabetes is lower, they have more, risk-based screening.
I see.
Whereas in our population, it makes sense for every pregnant woman to go through.
I see. So at least in the restructured hospitals in Singapore, every lady should have to go through this.
Yes. That is our protocol.
I see. So should a lady unfortunately come up positive for gestational diabetes or diabetes while being pregnant, what are the implications of it?
Yeah, that's itself as an episode, I think. But yeah, so gestational diabetes is usually a temporary diabetes of pregnancy. Most pregnant women are checked again by this OGTT 6 weeks after giving birth to make sure it's resolved.
Right.
However, it's very, very important to manage this condition appropriately during pregnancy to have the optimal outcome or the best outcome.
Right.
Because being diagnosed with gestational diabetes does put the pregnancy at risk.
Okay.
And these risks are applicable to both the mother as well as the baby.
I see.
What happens for the mum is that the mum is at a higher risk of getting medical complications such as hypertension or the blood pressure or preeclampsia, infections, type 2 diabetes in later life.
Okay.
So we would, advise accordingly. From the baby point of view, the baby can sometimes become very big if the diabetes is poorly controlled.
I see.
And that's called macrosomia or a big baby. That may lead to complications like needing a C-section for delivery or having a very long labor, or sometimes a very, very rare but serious complication can happen. It's called shoulder dystocia.
I see.
Where the head of the baby comes out, but shoulders, because they're bigger than the head, can get trapped.
I see.
And that's more common in big babies of diabetic mums.
Right.
But saying that, all these complications can be minimized or almost eliminated if the diabetes is properly controlled.
Right.
And hence the reason why we screen and we have an educational program.
Right.
Okay. The other risks include preterm delivery, need for intervention, and babies needing more help with breathing. Sometimes babies' sugars can fluctuate after delivery, and they need to be kept in longer to make sure the sugars are stable before they're sent home. Most centers will have an educational program for the mothers. So these mothers are managed in a multidisciplinary team setting.
Okay.
What that means is that there's not just the obstetricians, but there is a diabetic nurse.
Right.
There's a dietitian, even doctors who will talk to them about the importance of being active, eating a proper diabetic diet, which is mainly poor in carbohydrates and rich in proteins, with avoidance of sugars, and the importance of physical activity and keeping fit. So these are some of the things they would do. The women would also be required to monitor their sugars on a regular basis. We call it blood sugar profile.
I see.
So we give them sheets where they would, do the self-monitoring. We teach them. So during this educational program, they are taught how to do it, when to do it. They even get the machines that are loaned, or they can buy them at a very subsidized rate. So I believe it's about maybe $10 to $15.
Wow.
So then they are taught, and then they would, send, either they could send it to us virtually, that is by email or, faxing, etc., or when they come to visit the obstetrician, and sometimes people who have diabetes which is more severe than the others, they may need medication on top of that, which may be oral medication such as metformin, or very, very rarely insulin. And these women who are higher risk requiring medication are usually managed together with the endocrinologist, the diabetic specialist.
Yeah, so essentially what I'm hearing is that we will screen these patients. Should they be positive, there are a few educational things we have to do, some lifestyle changes to be made perhaps, and only when very severely they might have to turn to proper medicines as well as injections.
Correct.
I see. Okay. And so after we clear this whole milestone of diabetes testing, there is some talk about more needles in the form of injections and vaccinations for pregnant ladies.
Yeah. So there are few vaccinations that the Ministry of Health Singapore recommends for pregnant ladies, and these are in keeping with the WHO guidelines. So there are two main vaccinations currently. One is the flu or the influenza vaccine, which can be administered any time in pregnancy. So that is to prevent flu among the pregnant women, because flu during pregnancy can be more dangerous.
I see.
It can lead to higher incidence of complications such as pneumonia, needing hospital admission, or even HDU, high dependency, or ICU care.
I see.
It can be easily prevented by a simple injection, which is safe and has been there for many decades.
I see.
Okay, with not associated with many side effects.
I see.
Okay, so that's the first one. The other vaccine that is recommended is the vaccine for babies' immunity, and that is the Tdap or the Boostrix. So essentially, it covers tetanus, diphtheria, and pertussis or whooping cough.
Right.
Okay, and that can be given anytime after 16 weeks, best before 32 weeks.
Okay.
The reason is that there should be enough time for antibodies to form
Yeah.
and then pass to the baby.
I see.
But if they have missed the 32 weeks deadline, it still makes, a difference if it's given before 37 weeks.
I see. So what I'm hearing is that they kind of have slightly different purposes. The flu is a little bit more sort of mom-centric,
Yes.
as opposed to the other one, which is like the whooping cough vaccine, would be more for giving the antibodies that the mom makes to the baby.
Correct.
I see.
Yeah, so these are the ones that are currently recommended. But I believe there's a vaccination for respiratory syncytial virus or RSV that's going to come soon.
I see. And just to sort of have a very quick clarification as well, while the diabetes testing is compulsory, are these vaccinations compulsory as well?
No. Vaccinations are optional but recommended. So I always tell the women that ultimately it's your choice. But I think if you explain the rationale, most women would opt for it.
Yeah.
The other thing that women might be interested to know is that in the restructured hospitals, at least, MOH actually allows you to use subsidy for the cost of consult and the cost of vaccine the day they have the vaccine.
Wow.
So
okay.
that's kind of an added incentive for women
Right.
to increase the uptake.
I see. Okay. So now moving on from all of these milestones that we have so far, could we just maybe talk about what to expect during the second trimester, about what are normal things that they should be experiencing during this time?
So they get better because their symptoms such as nausea, vomiting usually resolve. They feel more energetic because they are used to the body is sort of adapted better to pregnancy. They start feeling the baby movements.
Yeah.
And they may have some mild aches and pains and discomforts, but they are usually not too troublesome. If they wish to plan travel, it's best recommended during the second trimester.
Right, sort of
and then they
now's
should
the time.
correct, yeah. And then they should also consider, going for the vaccination.
I see. And just a very quick note on these babies' movements and things like that. What is, say, a normal amount of time? Should I be concerned if I can't feel my baby for say, few hours?
So every baby has its own cycle. So the baby's sleep cycle lasts for 60 to 90 minutes. And babies don't keep moving all the time.
Right.
But it's very important to remember that fetal movements are a sign of fetal well-being.
Yeah.
If they move less, then they may be a signal to tell us that this may be something
Right.
not normal. So usually we would tell them, that count till 10. I believe you might have heard count till 10. What that means is you start counting the movements, and once you hit 10, then you can stop counting. What that means is if the baby's already moved 10 times, then it's fine.
Right.
Okay. But what I would say is every mother would know their own baby's cycle, and if it's anything which doesn't feel right or normal, it's best to, get in touch with your doctor or walk into the emergency to get a check.
Right.
Okay, it's better to be safe than be sorry.
I see. And when you mentioned this whole count to 10 thing, would that be sort of every day or every hour?
So it's 10 movements in a day, actually. Once they, obviously the baby moves many, many, many times,
Yeah.
more than 10. And once you hit 10, that means,
You're good.
yeah, you're absolutely fine.
I see. Okay, sure. Well, thank you so much for that, Prof. And I think, the second trimester is a much happier time, as you mentioned. And
Easier as well.
yeah, definitely. It sounds much better. As a quick conclusion to it, in your opinion, what's the best part of the second trimester?
I think feeling better, feeling the baby movements. That's really, really exciting especially the first time mom, but
Yeah.
any mom, to be honest, and also maybe seeing the baby on for the screening scan, looking at the details, because that scan, you can actually see the baby quite well.
Wow.
So yeah, these are some of the highlights in my opinion.
It sounds like all around probably a really, really exciting time.
Indeed, yeah.
Yeah. So, well, thank you so much for, your information and all the insight, Prof. So once again, I guess we've come to the end of the second episode now. So we hope that you have found the second episode on covering the second trimester enjoyable, informative, as well as, fun throughout this journey through pregnancy. Once again, Prof will be joining us for the third trimester, where we'll be covering basically some things to expect, do's and don'ts, some warning signs as well to look for during this time. Once again, if you've enjoyed this episode, remember to like, subscribe, and share Girl Talk on all our social media platforms, and we'll see you on the next episode. Thank you. Hi, thanks for watching this episode of Girl Talk. If you enjoyed it, feel free to like, subscribe, favorite, and follow Girl Talk on all our social media platforms. We hope to see you on our next episode.